Time now for morning rounds. One of the biggest health issues lately is vaping. This can mean using e-cigarettes or other vaping devices that contain nicotine or THC, the active ingredient in marijuana.
According to the most recent data from the Centers for Disease Control, there have been 380 confirmed and probable cases of lung-related illnesses linked to e-cigarettes or vaping products. This has occurred in 36 states with 6 confirmed deaths. Major questions remain. Here to discuss that and more is CBS News medical contributor Dr. David Agus. Got to ask you, this never seemed like the best idea to inhale any substance for a lot of people. So what is going on now?
You know, vaping came from a pharmacist in China said, hey, there's not enough tobacco and it costs too much for China. Let me figure out a way to get nicotine into the lung. And you need a carrier molecule. This molecule carries nicotine in the lung and it stays there and over time can cause problems. So, you know, it took over 2 decades to show that smoking tobacco caused lung cancer. And when we put this on the market and we allow kids to use it really without long-term testing, bad things can happen. I think that's what we're seeing now. And so it scares me that we're doing experiments with children. And there's new regulations this week by the FDA. Take away all the flavor components will hopefully limit its use in children.
Do you really think, though, just by doing that, that this is going to hamper use, not just in children, but in adults also?
It's a start. You're right, I think we need a much stronger FDA to say, hey, we have to test this. It's going to the lung directly to the bloodstream. We have to test this before we allow it on the market. And when you had companies like Juul who claimed on the package safer than smoking, and last week the FDA said, hey, you can't do that until you show it. That's what we really need, is we need data.
So if the FDA is designing guidelines moving forward, then what should they be doing at this moment?
You know, the hard part is that you need time, right? In order to test the safety of something, you have to test it for years to see what really happens. We have to do real testing on these compounds that kids are using. We have to do testing on things that go into the lung to see, does it cause problems with the lung? Does it cause DNA changes that can lead to cancer? And the answer in this case, in many cases, it's yes, they do cause problems.
Okay. According to the Alzheimer's Association, an estimated 5.8 million Americans are currently living with Alzheimer's disease. And by 2050, the number is projected to rise to 14 million.
It's a disease that not only impacts the patient, but also their loved ones and caregivers. Earlier this week, Dr. Mehmet Oz announced that his mother was diagnosed with Alzheimer's, writing in an Instagram post, quote, hearing the official diagnosis was devastating, but just as painful for me was the realization that the signs were there all along. I had just been overlooking them. And we know he's a friend of yours. In your conversations that you've had with him since, what has stood out? That line right there does when a doctor doesn't recognize the signs.
You know, first of all, when someone talks about a mistake they made publicly to help others, I think that's powerful. And Mehmet did that this week. And, you know, I think he felt bad when he looked back. Those symptoms were there for a year, and he didn't notice them. And since then, he's been tested, and he has one of the genes for Alzheimer's, and he's talked about that. And we talked about ways he can actually prevent or delay the onset of Alzheimer's in him, and how he's taking those actions. And hopefully, he could be a lesson for others to do that.
Are there risk factors people can control?
No question. Is that what you can do is things like just at night having quiet. When you have your partner snoring or noise in the background street, that actually your brain needs quiet. You put orange foam earplugs, you reduce the level of cognitive decline as you get older. Every year you delay retirement, you reduce Alzheimer's by over 3%. You don't use it, you lose it. There are medicines that block inflammation in the brain. All of those need to be talked about with your doctor and your lifestyle. And hopefully Dr. Oz stepping up can help other people.
Yeah, always, the earlier you see some signs, the better off you are. Dr. David Agus, double duty for you today. Thank you.
There you go.
Good seeing you.